Hi, this is Yemi. I'm going to continue where I stopped yesterday, talking about uh, foundation of mental health, an overview. Today, I want to talk on three major topics: wellness domain, factors that affect mental health and recovery, and critical aspects of mental health care. Uh, Wellness is described as being broader than health because it involves all aspects of our lives, including how we function in our society. The concept of wellness has gained a lot of attention. Even SAMHSA, which is Substance Abuse and Mental Illness Services Administration, has identified 8 dimensions in the areas of emotions, environment, financial, intellectual, occupational, physical, social, and spiritual. But we're going to be talking about, discussing today, I'll be talking about 5 major wellness domains that we use in understanding our mental health. The first one is biological. Biological domain of mental health affects all our body systems. When all our body system is functioning well, we maintain our life and our social functioning. Basic to biological domain, things that we help our patient to achieve is, exercise, rest, diet, relaxation, and sleep. Because we try to promote, as nurses, we need to promote healthy living, like health promotion and disease prevention, not just taking care of a patient or curing these illnesses. We do that by having them like where I used to work, and encouraging patients to have an exercise regimen, because some of the medications that they eat actually provide side effects like excessive eating that makes them gain weight and push them into cardiovascular problems like diabetes, high blood pressure, high cholesterol, and so on. So the next domain is psychological, which refers to our attitude and behavior. Ones that we can express in psychological need, like self-concept, how we feel about ourselves. A lot of people have low self-esteem based on their experience in life and not feeling that they are not going to be accepted. Wellness, the wellness domain in psychological can actually express onset of disease that can interfere with regaining their wellness or their ability to tolerate pain, experience pleasure, or be responsible for themselves or other people. And then sociological domain focuses on our environment, needs related to love and belongingness, feeling safe, sufficient economic resources, food, shelter, cultural domain. Something is described as being bringing. We believe that all our patients bring their cultural beliefs into the hospital. So we as nurses, we learn to study other people's cultures, understanding what is acceptable and what is not. Even in terms of greeting, we learn to respect that, so that our patient is not distressed about our behavior when they are in our care. Because if we do this, that helps us in, it doesn't lead to disparity, meaning that we are not providing care in the same manner to everyone. The spiritual domain talks about sense of peacefulness, seeking meaning for purpose in life, and faith and hope, attributes of spiritual health. And we have to take care of our spiritual health as well as our physical health, because that makes us to be completely healthy. In hospitals, we find out that most hospitals, even hospitals that are not mental health, has a place of worship where patients are encouraged to go to, or even family to pray, meditate, and even in mental health, pastoral care are allowed to come in, not just during visiting time. They are allowed to come in and minister to their, congregates, and like that. Then the other aspect that I want to talk about that affects our factors that affect our health and recovery. Nurses we need to understand that what are the events that affect our patient's level of well-being, things that might make them to go into agitation, things that can make them suffer as a result of other people's behavior around them. We want to promote behavior that alleviates suffering. So we need to do our self-examination about our perception. So one of the things that might affect recovery is stigma. Stigma is described as being discrimination or social rejection. We hear in the news that a lot of people and the media perpetrate that believing that people who suffer from mental illness are violent people, even though research says that that's not the case. It's very rare. Stigma makes patients feel overwhelmed, frustrated, angry, and they might actually not want to access care because of that stigma. Because I read some patients, even they go to their primary, a lot of patients with mental health illness, like I said, might suffer from comorbidities like medical conditions, but when they some of them express that when they go to see their doctors to complain about their physical ailments, they concentrate more on the psychological, the mental health problems. So not believing them, their complaints and things like that. Other things that can affect recovery is adherence to treatment, and this could be due to financial, could be due to side effects or difficulty accessing treatment. And a way that we help, that I know we do help to alleviate this for our patient is, number one, somebody who has one of the problems with mental health is especially people who have schizophrenia and they don't believe that they are sick. So you only take medication for headache. If you believe you have headache, you take medication for that until they become really psychotic, that is losing touch of reality, becoming agitated, and danger to themselves or others, that they are hospitalized, that they are forced to be medicated, and when they are stabilized, they kind of start to understand their condition, and we need to help them to understand some of the side effects of the medications also. That is where education comes in. We do really good with education of our patients, because we don't want them surprised by side effects and they will just stop taking the medications. So, and difficulty in assessing treatment, they have social worker that helps them, and they assign case managers. Access also to access treatment might be due to affordability of their medications, or if they don't feel they are getting effective care, because even patients who are taking their medications religiously can sometimes go into exacerbation of their symptoms. So these are some of the things we help them to alleviate. Enough good education, social worker, and case management to help them with housing, location of housing, and transportation. Other things, major things that I mentioned I will discuss is critical aspect of mental health care. One of them is safety. Safety is priority in mental health. Priority to ensure and promote that our patients are safe, not just our patients, their families, and also the staff. Some of the risk for safety is self-harm, restraint use, seclusions, medications, fall, risk, and milieu management. I mentioned about milieu management in my previous video. Like, we need to manage our environment, that's so the fact that our patient feel safe and calm, noise level and all that. We use everything first, like seclusion. We don't want to restrain our patient as the first line of management of their agitation. We have to learn, as if you are going to work in a mental health environment, you go through training like crisis intervention, what to do if your patient becomes agitated, and how to be safe. And that would take me to trauma, which is another aspect of the critical aspect of mental care. Trauma-informed care. We believe that many of our patients that comes to mental health, they have experienced violence, abuse, or neglect in their childhood. So in our assessment, we elicit some of this information from them in order to plan our care so that we do not re-traumatize our patients. Like I said, we do not want to tie someone, for example, who has been through physical abuse or rape in seclusion, frosting at the sight of them being agitated. In our assessment during interview, we ask our patients what are the things that we can do to help them calm down when they become agitated, and we note those down. We want to help them talk in a calm manner to them, and also we do not want to leave an agitated or anxious patient by themselves. We offer them choices in terms of going to their room or taking medications before it gets to the point where they have to be secluded or restrained. Other aspect, critical aspect of mental care is suffering. Suffering is a state of enduring pain and distress, and we have 3 dimensions that can affect our patient. Physical suffering, like fatigue and pain, and like we can medicate, we can give pain medications, we can do other things to alleviate pain, like use of touch, massage, use of yoga, relaxation techniques and things like that. Then psychological suffering, which can be expressed as depression. They can be medicated. They could be. Also, we can use other things like talking to them, like being present, making sure our patient feels like they are our priority. Social well-being patient can be suffering being withdrawn or isolated. That is why in some instances where I've worked, we actually reward patients for attending groups because we want them to interact with other patients and staff. We don't want them to be isolated or withdrawn. Other thing that affects a critical aspect of mental care is hope. Hope is described as having goal-oriented thoughts or emotions about future, and we need to we achieve this for our patient by being connected to them, by promoting hope, like being present, like I said, willingness to listen also to our patient's stories, and making our patient feel like we are following their stories, rephrasing what they tell, and using phrases like "tell me more about it," and being present and listening, active listening to our patients, gives them hope. And also the last one is the perception, thoughts, and feelings. as nurses, if you want to work in mental health, you need to, check your perception, how you feel about mental health. You need to, because we need to be accepting of our patients. You know, the way we think, it is not because they are not healed, because they are weak, or they have committed a crime, or they are paying for their sins and things like that. We need to be open-minded, be objective, accepting, and because when we are able to do this, then our nurse-patient interaction will be effective, and it will improve that. Thank you. I think that's the end of today's talk. Next week I will be going over, I will start on talking about disorders, like talking about anxiety, stress, and coping. Please don't forget to leave your comments and subscribe to my channel. Thank you.